In HealthWorks, 2 million Americans will be diagnosed with cancer this year. That's according to the American Cancer Society. Joining me to talk about a newly released report is Dr. Jonathan Villena, Assistant Professor of Cardiothoracic Surgery at Weill Cornell Medicine. Welcome to Houston's Morning Show.
Hey, good morning.
Well, that number happens to be the biggest in history, which does sound discouraging, but there is encouraging news when it comes to death rates. Tell us about that. More people are able to survive cancer now?
Yes, definitely. So, we've kept the data since basically 1991. We've seen a decrease in all cancer mortalities, which is really important because it equates to about 4.1 million lives saved. A lot of it has to do with, newer treatments and better ways to diagnose patients early.
Well, that is very promising. Hopefully it gives people a little sigh of relief, although no one wants to go through it, obviously. All cancers a cause for concern. One seems to be the biggest now, though, and that's colorectal cancer. What do you think is driving an increase in these rates? We're talking both men and women, and now the leading cause of cancer death?
Yeah, no, you're absolutely right. So 20, 30 years ago, colorectal cancer in this specific age group was about the fourth highest cause of death. Now it's number 1 and 2 for men and women, respectively. There's a lot of factors that go into this, but one of the major ones that we're seeing is that this trend may be due to the rise in obesity that we've seen in the last 20, 30 years. And now that's equating into a higher risk of colorectal cancer, specifically in this age group.
But the biggest thing about this type of cancer, it is one that is preventable. You can catch it early before it turns to cancer. So what are the recommendations to make sure people are getting this done and know that that is an option?
Yeah, definitely. So a lot of it has to do with patient education and going to the doctor, right? So colorectal screening is actually a colonoscopy, and it's recommended at 45 years old. Now, an important thing to know is, obviously, if you have any symptoms, any bloating, any unexpected weight loss, or any blood in your stool, then you should go earlier. But also very important is that 1 out of 3 of the colorectal cancers are actually familial. What that means is that there's a genetic component. So you have to know your family history. If your mom, your dad, or somebody in your family that's a blood relative has had colorectal cancer, you got to tell your doctor, because that may move your screening down even 10 years earlier, so at the age of 35.
All right, everyone, listen to the doctor. Please take that advice. Rates also increasing for other cancers. Do you feel like it's due to lifestyle, our typical American diet and lifestyle, or do you think people are skipping those important screenings?
Yeah, I think a lot of it has to do with lifestyle. 42% of all these cancers are actually preventable. And what that has to do with is diet, exercise, decreasing the rates of smoking and alcohol. So this uptick in the younger population, a lot of it is preventable if we alter our lifestyle early.
And so we take a look at that list. It seems like they are all doable things. It sounds like it's truly time to live in moderation the best that you can. It makes a big difference, doesn't it?
Absolutely.
All right. Well, thank you so much for taking time to talk to us today. Important information coming up. Hopefully it will make a difference in people's lives. Have a good day.
Thank you. You as well.